All right. Well, good morning, everyone. I think we can now get into the content for today. This is a session where the department, as well as the Pennsylvania Association of Managed Care Organizations and representatives from some of the Medicaid MCOs, will be providing some guidance to you all about the steps to become credentialed, to contract, and to bill the Medicaid MCOs for those new services that pharmacists are able to bill for in the Pennsylvania Medicaid program. So we're very excited about these updates, and I think we can probably move into the next slide.
Okay, thanks, Gwen. Can you all hear me?
Yes, we can.
Okay, good. Because I just want to warn everyone another housekeeping item. So while I'm sharing my screen, I can't see any other controls. I can't see the participants. I can't see hand raise functions. So I can't see myself. So I know I'm on video. I know I'm unmuted, but I'm going to have to stay that way if I'm going to be sharing my screen. And so I just want to maybe ask to see, Gwen, if you or Kim could just be ready to share your screen, just in case,
Of course.
my stuff goes wonky on my end, and I have to stop sharing for some reason. I would really appreciate if one of you could pick it back up and start sharing, because I have to be on the web-based Teams platform for some reason. So I
Not a
apologize that
problem.
that's at the beginning of the recording, but I'm Emily Katz. I'm the executive director of PAMCO. That's Pennsylvania Medicaid Managed Care Organizations. I'm really pleased to be here this morning with everybody today, and thank you for joining and taking time out. It's nice to see so much interest. As you can see, PAMCO is made up of the physical health managed care organizations in Pennsylvania. All of them are part of PAMCO. Their names are here. Hopefully these are a lot of familiar names to you, so I'm not going to read them to you because you can see them here. And as Gwen said, the slides will be made available. And what you're going to hear today is really a general overview about working with the plans, because each of them are going to have their own contracting processes and credentialing processes. And so this is really a general conversation, but I have experts on the line from each of the plans to answer any specific questions and general questions that maybe Gwen and I can't answer for you today. And so please, I know that a lot of the time today is going to be set aside for question and answer. And so we're going to run through the slides. And then, as Gwen said, I think we'll set aside a lot of time at the end to answer your questions. We have a lot of people on the line who are experts who should be able to answer a lot of those. So I look forward to the discussion. And I'm going to just pass things over to Gwen for the next slide.
Great. Thank you, Emily. So to get us started, I'm going to give just a brief overview of the Health Choices programs, as well as some of the terms that you're going to hear throughout today's presentation. Some of them may be familiar to you, some of them may be new, but because Medicaid can be full of jargon, we thought that it would make sense to begin today just with some level setting on definitions and vocabulary. So Health Choices is the name of Pennsylvania's medical assistance or Medicaid managed care program. Medical assistance, Medicaid, those terms are completely interchangeable. They mean the same exact thing. And Health Choices is the name of our managed care model that has been operating in the Medicaid program here in Pennsylvania for over 25 years at this point. Medicaid, if you're not familiar with it, is an entitlement program, which means that anybody who is eligible for the program is entitled to any of the services that are covered by the program. Eligibility is determined primarily based on income. That's the main way that we look at who is eligible, but there are some other eligibility factors, such as disability status, for example. The Medicaid programs are jointly administered and funded by the state and federal governments. So the Department of Human Services, that's the agency that I work for, we manage the Health Choices Medicaid Managed Care Program in Pennsylvania. Every state has a different Medicaid program, so if you offer services in a different state, you would probably have to learn some different rules. So today we're really just focused on Pennsylvania. Through Health Choices, Our Medicaid managed care organizations, MCOs, you're going to hear us use the term MCO a lot today, so that's an important one to commit to memory. They really help our individuals who are eligible for the program receive access to those high quality services, including physical health, behavioral health care, and long-term services and supports. We have different programs for each of those benefit packages. The relevant one for pharmacy is really physical health choices as well as community health choices. Those are the programs that pay for pharmacy services. PAMCO, which you heard from Emily earlier, it's sort of the organization of the physical health MCOs altogether. So these are the MCOs that you're going to be working with throughout the credentialing and contracting process. They're the ones that you'll get to know really well, and they're the ones who are on the line here today to help answer your questions. So Emily, if we can go to the next slide. Thank you. So in order to figure out which MCOs you need to be working with, you have to take a look at this map here. The Health Choices program in Pennsylvania is administered through different regions. We call them zones. There is the Northwest, the Northeast, the Southwest, the Lehigh Capital, and the Southeast zones. And you can see here that they're color coded. There's a key down at the bottom that tells you which MCOs operate in which zones. So not every MCO operates in every zone. So what's really important is for you to be thinking about where the patients that you work with come from. And that is important because enrollment in Medicaid MCOs is driven by the residence of the beneficiary or the patient. And so if, I myself reside in Dauphin County, and so any provider who is going to provide me services would probably be looking at that Lehigh Capital zone and seeing who the MCOs are that operate there and would think, I see patients from Dauphin County, they're probably enrolled in one of these plans. So this is the way that you can start to figure out which MCOs you need to reach out to for credentialing and contracting and billing purposes. You can certainly play it safe and work with all of the MCOs, or you can, narrow down the list of the ones that are most important for you to prioritize, depending on the patients that you see. Next slide. This really is, we're going to start to talk about the way that the Medicaid program is organized and operated. So as I said during my introduction, I work at the Pennsylvania Department of Human Services. We get our budget through the Pennsylvania General Assembly, the legislature, and then that comes through to my office, the Office of Medical Assistance Programs. We administer this program through two different, what we call delivery systems. And I do think it is important for folks on this call to get familiar with these two different delivery systems because you may be seeing patients who are enrolled in either of these programs. And so having a little bit of familiarity with both of them is going to be helpful for you. One program is called Fee for Service. This is a small program. The enrollment is, I would say, less than 200,000 people, I think, and it's largely people who have newly been determined eligible for Medicaid and have not yet been assigned to a managed care organization yet. They remain enrolled in our fee-for-service program. In this case, providers are submitting bills or claims directly to the Department of Human Services, and DHS pays those claims directly to the provider. So you would know that you were seeing a fee-for-service patient if they had only an access card, if they didn't have a managed care organization ID card. You can also use the electronic verification system to confirm someone's enrollment. The other way that you can be paid for services is through our managed care delivery system. And that's what we're really focused on here today. Everything we've been talking about with health choices and with the MCOs, that flows through managed care. So in this program model, the department pays a capitated payment to the MCOs, and the MCOs then make payments to their in-network providers. There are different ways that the payments can be structured. It could be a fee-for-service payment, could be a capitated payment. That's really going to vary, and that is what you are negotiating during the contracting phase with the MCO. You are determining what services you will be paid for and how you will be paid for them. So when you're entering into the contracting phase here with the MCOs, that is your opportunity to look at what services you're providing that you'd like to be paid for. You know, the department recently put out a medical assistance bulletin explaining the services that would be covered under the fee-for-service program. And so the MCOs are required to cover at least the services that fee-for-service covers. And so if there's a service that you're not seeing in that MA bulletin that you believe is within your scope of practice that you would like to be able to offer to patients, that's something you can bring up during the contracting phase with the MCO, you know, if you're looking for additional services to be covered and paid for. So I really think that that is the majority of what I wanted to present here, and I think Emily, I can turn back over to you.
Thanks, Gwen. I just realized we did not link the bulletin anywhere in this presentation, so maybe we could drop that in the chat or put that in with when we
I will
circulate
take care
this.
of that.
Thank you very much. I know you're on top of it. So I promise this is going to be the very end of kind of the overviews before we get into the nitty-gritty, because I know a lot of you are probably familiar with this, but I just, you know, you can read what's on the slide, but really I just wanted to give you a sense of, you know, what the role of the MCO is. And, you know, at the heart of it, it's really care coordination and, you know, bringing all of these various providers and services together so that you know, the care of the member is at the center of it all. And so, you know, the next slide kind of shows you that really just in a picture, so that we just make sure the person is getting the care, you know, when they need it and where they need it. And pharmacy is just such a critical part of that. And pharmacists play such a critical role. And so, you know, it's great that we're at this point where you can enroll and, you know, play a part for medical services. So let's get into, you know, more of that part of the discussion about connecting and enrolling in MCOs networks and credentialing claims, et cetera, because that's all what's coming up next. So when you look at this next slide, you know, this is kind of, you know, and so I have on the right, you can see steps 1, 2, 3, 4. I really want to remind everybody that step 1 is just really critical, that getting enrolled with the department is necessary for all the other steps to take place. The department held a training session February 15th. There's a link in here to that. And I'm sure we could drop a link in, you know, and make sure everybody has access to that. It's, I'm sure, up on the department's website. And so that's really key to make sure that you get your Promise ID. And then the credentialing and contracting process, steps 2 and 3, don't necessarily have to happen in that order. Sometimes they are happening at the same time, that you are being credentialed and contracted at the same time, so that as soon as your credentialing is complete or as soon as your contracting is complete, you're ready to go and there's no waiting. And so those may happen simultaneously, or your contracting may happen first and then, you know, we may, you know, have to wait for the credentialing piece, but 2 and 3 may not happen in that necessary order. So I just wanted to call that to your attention. But then, of course, all of that has to happen before any type of claim would be submitted to an MCO. You need to be part of the MCO's network, and you need to have a contract in place before you can submit a bill. And part of that is just how the federal law and state rules work. So as I just said, there's a law that requires you have a contract with providers in order to pay. And so each MCO is going to have a different payment rate, you know, depending on, you know, what you negotiate, and, you know, what is, you know, set forth in the contract. And the contracting will take place with each MCO, as Gwen noted, when you saw that statewide map. And just to call to your attention, in that map, there are 4 MCOs that serve the entire state. And so you would be working with at least those 4 no matter what. So take a close look at that map when you're looking to see where your members reside. And then I just wanted to bring to your attention on this next slide, slide 10, some terms you might hear during MCO contracting. Mostly it's going to be fee schedule. What are the fees you're going to receive, for your different services. Value-based purchasing and bundled payments are something that the MCOs, as you move along in payments and sophistication, these are terms you might start to hear. But, initially, likely a lot of your contracts will be just based on, fee for service or a fee schedule. But I don't want to speak for all the MCOs. That's just an assumption. But so, I put in there that, MCOs do have a requirement in our contracts with the Department of Human Services that the majority of our payments to providers are in some type of value-based payment arrangement. So next, I'm going to hand things over to my colleague, Kim. And Kim Beatty, she's from AmeriHealth Caritas Keystone First. And Kim, I don't know if it's easier for you to do things if I stop sharing and you do it from your end for the demo, or tell me what's easier.
So why don't we start with this slide, and thank you, Emily, and then I'll actually share my screen to go to the live demo. How's that?
Okay, so after this slide, I'll stop sharing and you can take over. That sounds great.
That'll work. Thank you so much. So as Emily shared, the very first step to becoming able to provide services to our members is through the contracting process. So from a Keystone First perspective, and I'm sure you're going to see this replicated with all the other MCOs, you would actually go onto our website, which I will go to in just a moment, to fill out the contract application. And this is just a snapshot of what that application looks like. It asks for very general high-level information. What type of plan are you enrolling in? And as Emily said, it would be the Medicaid or the Health Choices and LTSS plans. What's your provider type? So in this case, you would be considered a specialist provider in our network. The name of your organization or your pharmacy, the group NPI, the tax ID number, pardon me, and then general information around locations. Keystone First would then review. As long as we have all the information that we need, we would develop a contract or draft a contract, and we would send it to you within 14 days. And the instructions would include to review it, and if there were any questions, a contact for you to reach out to, and then to sign it and return it to us. Once the signed contract is in place, we can then begin to credential your providers. So Emily, if you'll stop sharing there, I'll go to the live demo. So embedded, can everyone see my screen? I'm sorry.
Yes.
So in the slide deck itself, there is a link to this web page where it takes you to the Join the Network page for our providers. And as you can see, this page provides all the information a new provider would need to join. The first question it asks is, are you a non-participating provider? And explains that all providers must be enrolled in the Pennsylvania State Medicaid program before payment can be made on a Medicaid claim. Then it takes you to the contracting section. And as you can see, there's a link here, and I'm hoping that the web app will follow us and you can see it. Are you able to see the contract application?
Yes.
Yes, we are.
Thank you. So this is the snapshot of the form you saw on the slide deck. And again, very basic information. What type of contract? It would be Medicaid and CHC if that's what you chose. Attach a W-9 Your provider type would be specialist, and you would be putting pharmacist as the provider type. The name of the entity that you'll be billing from, the group NPI, and then the contact name. Who would we speak with in order to contact, and who would we work with in order to credential? Primary locations of your service locations, and then the list of pharmacists that you would want to be able to contract with us for these services. The information to submit is available on the form as well. I'm sorry, right here at the bottom. You would submit or fax. The preference is email. It's a quicker response and easier for us to obtain the application in a timely manner. And then there are additional questions that potentially could apply around what services would you like to be able to bill us for? What should we expect to see, or should we look to discuss with you from a contracting perspective? And then this is our internal area here where we simply do a review and approve to process a contract draft. Pardon me. So that's the first step, the contract application. And I'm hoping, all right. And then after you've successfully obtained a contract, it's signed and we're ready to begin the credentialing process. So here's the credentialing information on the web page. And as you can see, it gives you two options. For those providers that have a CAQH, we have a standard CAQH application checklist. And again, I'm simply clicking on the links provided. And what this gives you the ability to do is submit the necessary information to begin the credentialing process for the pharmacist. And you'd want to complete a checklist for each pharmacist that you would like us to credential. And again, it tells you where to submit. You're given an email address as well as a fax. And the information, again, is just high-level information to begin the CRED app. What plans are you looking to apply for? TIN numbers, NPI, that would be the group NPI and the individual NPI. Again, the individual Medicaid ID number, that would be for the provider. The CAQH issued number, and this is a number specifically for those using this application. It is a national application used for credentialing of providers. So many providers already have a CAQH established. This number would go in this area. And then again, you would identify as a specialist, pharmacist as your specialty, and information around credentialing contact information. And that's very important to us. Should we have an incomplete application or need additional information, that information is what we would look to in order to reach out and obtain that missing information. And then other information around race, ethnicity, and languages spoken. And this is really important. I stress to my providers all the time how relevant this information is to our members as they access care. So a lot of times when we get the applications back, it's actually checked that someone's decided not to say. Again, I can't stress enough how important this information displayed in our directory is for our members when they select care from a provider. And then again, the bottom half of this checklist really talks about the required information that we would need to accompany the applications. So it just runs through those areas applicable is what you would check off to make sure that it's up-to-date information in your CAQH. Should a pharmacist, for whatever reason, determine that they don't want to use the CAQH process, you do have the option to complete a credentialing application. And this is a standard PA credentialing application that would be used in place of or for a provider that doesn't currently have a CAQH. And again, it asks very standard information around the provider, and it's provider specific or pharmacist specific. All information's needed in order to credential the pharmacist to be able to provide services. So this application is available as well. And when you submit the application to us, we do then ensure that once that contract application is submitted, you have a contact. So someone that you can reach out to with any questions along the process to help guide you or address any concerns that you have. I'm going to stop sharing there. And Emily, if you want to bring back the slide deck, that would be great.
Sure, give me 1 second.
Sure. So, Emily, did you want questions addressed in the chat now, or will we wait till the end during the Q&A?
I think let's wait till the end because there's just a few more slides, Kim, before the end. And so why don't we address them all?
That works for me. And Emily, I'm sorry. Can you hear me okay?
Yes, Kim, we can hear you.
Thank you. So I believe we're on the current slide. Yes. So each MCO that you determine that you would like to contract with, you will also need to credential with in order to have claims paid and for you to be listed in the directory. Again, that directory information is very important. That is the venue our members use to access care. It also helps for our providers when they're looking for other providers to assist them or support them in care of our members. So once the initial credentialing application is complete, it's sent to the MCO's credentialing committee or department. It's generally assigned within 30 days to complete the file. If the credentialing specialist deems the file incomplete, they're going to reach out to that CRED contact information that you provided in order to obtain that missing information. Please note that if the missing information is not returned, the file will be discontinued. When that happens, the entire credentialing process would restart once that the missing information is received. A complete file information is added to our credentialing database, and then all the verifications are performed. So all the information that you provided us regarding education, training, and licensure, all has to be verified by that CRED specialist in order for the file to move to the credentialing committee. Once all the primary source verification has been completed, the file is then submitted and becomes approved the date of the submission. Claims processing can be backdated to the date the application was submitted, as long as the provider has an active promise ID for that data service. We can move to the next slide. Thank you, Emily. And then this is an example of what information will be required in the CAQH or along with the PA standard application in order to begin the credentialing process. National Provider ID, that's the NPI, the state license number, malpractice insurance, education, DEA, sanction checks, CAQH. Again, if you have a CAQH number, that should be provided. If not, then the standard application. A CLIA waiver, if applicable, and the CLIA waiver would be for labs performed. Ownership disclosure, a promise ID, and then the NPDB, the National Practitioner Database. Again, it's just a review that we do during credentialing. And Emily, I think that completes my slides.
If we could, Kim, I would love to go back to, this is Gwen, to go back to the checklist on slide 13, just to clarify something, because there have been some comments in the chat and we can discuss this more during the Q&A, but I think it might be helpful to address it in real time regarding the CAQH.
Sure.
My understanding is that all of the MCOs accept the CAQH but do not require the CAQH. Is that correct?
That is correct.
Okay, so we'll
That's
have to
my
make a
mistake.
correction. We'll
I
just have to
will.
make a correction to that slide, and we'll be sure to distribute that version of the slide when we post it online. Thank you.
Yes, I did a quick edit this morning and should have said accept and not require. That was my bad. I take that one. And
No
I
problem.
also take ownership of the spelling error at the top. Okay, let's move on from that slide. Golly. So this is just going to be a very high level overview. I'm sure a lot of the pharmacists on the line are familiar with what a claim is. Providers submit claims. It's your request for payment. We generally ask that you use a CMS 1500 form. All the resources for billing and claims are all on each individual MCO's website, but also all of this information will be spelled out during your contracting process about, how they'll want claims submitted and, what, codes and things that you're going to be using. And so you're not just going to be kind of left to figure it out, but I just wanted to give you a general sense of the fact that you are going to be submitting claims to the MCOs. So here's that pretty CMS 1500 form. And so, basically we're saying submit a claim for each service. That's saying fee for service unless you come to some other payment arrangement with your MCO. FQHCs are likely going to have a different billing approach, but please stay tuned on that. I know the department is talking to CMS and there's some side conversations going on, so I'll leave that to experts. And so we may address that a little bit more in the Q&A, or if Gwen, if you want to jump in here at the end of this slide, feel free. But again, I just wanted to stress that, all of these resources are going to be found on the MCO websites. And at the end of the presentation, there is a list of all of the MCO contacts for credentialing, for claims, for pharmacy, and a website for billing, claims, and for credentialing as well. So hopefully you find that helpful. Gwen, is there anything you wanted to add about the FQHC piece, or is it just still a TBD?
Yeah, thanks, Emily. The question about how to bill for pharmacists who are employed by FQHCs is one that the department is discussing with our federal regulator and partner CMS, the Center for Medicare and Medicaid Services. And so guidance is forthcoming regarding FQHC billing. So MCOs and pharmacists alike should kind of stay tuned for additional guidance from the department on that point.
Okay, hopefully they don't make it too complicated and just keep things easy for everybody.
We would certainly appreciate that.
Right? Okay, so then claim submission, claims, and this is all, I'm speaking in general terms here because of course there may be, outlier situations, but this is 180 days after the services were provided. But of course, we're assuming you want to be paid much faster than that. And so, these are just some of the rules about submitting claims, that the billable services provided to the members must be submitted by the provider who performed the services. MCOs usually prefer an electronic claim submission, but if you must use paper, I believe every MCO has a way to receive paper claims. So, I just wanted to say usually submit it electronically because that is generally the preferred method, and I would assume that is also your preferred method, and also much faster and cleaner. And then claims are usually paid by the MCO within 30 days. And I say usually just because of, cleanliness, et cetera. But we have a very fast way of paying, and the department makes sure that we pay fast. And so this last line is just, again, your MCO contract is going to outline, all about how you should be submitting claims and about payment, etc. I believe this is one of the last slides before we have time for Q&A. So this is really just about documentation. MCOs have to sometimes audit providers, and just take a general snapshot of claims. And so, providers have to document, and I'm sure this is not new to many of you. And so just keeping the documentation is important. And 7 years of records, I believe, is the rule. Or I shouldn't say I believe, 7 years is the rule. So, everything that's on the slide here, I'm not going to read everything to you, but again, this is all just, we're making sure that the services we paid for are being performed, and in case there is auditing, we need to be able to access records. All right, I was correct. Those were the last slides. So as promised, there are contacts for claims, there's contacts for credentialing, and pharmacy contacts. So I just wanted to make sure that everybody had that information, and we will be sure to send out an updated slide deck to this group. But I believe I can stop sharing, or I can bring up any slide that anyone would like me to go back to.
Thanks, Emily. We'll start with the Q&A portion then, and I'm going to begin with the questions that we have a record of in the chat, and I'll try to keep up with that. And once we get through those, then we'll offer the opportunity for folks to raise their hand and say their questions out loud if you'd prefer to ask a question that way. So the first question that we received was, how do you obtain the CAQH number if you are a pharmacist? I provided a response in the chat here, but wanted to say it out loud for those that are attending via phone and those that may watch in the recording in the future. If you choose to use CAQH, you would register with CAQH itself through their website. We did include a link in the chat, but we can include that in written resources in the follow-up. And you would create an account with CAQH and go through that process through CAQH directly. Once you complete the process with them, you'll receive a CAQH number. And just to reiterate, CAQH is not mandatory. It is accepted by all MCOs, but not required. And I'm going to go down to a related question that was kind of a follow-up, and then we'll get back in order. But if CAQH is not mandatory, what is the purpose of a pharmacist getting a CAQH number? Is there a benefit of going through CAQH? Does it provide faster service? I can start with an answer, and then Kim or any of the other MCO credentialing reps, I would really appreciate either confirmation of what I say or add anything that I miss. But it can be helpful because CAQH is a single application that you would fill out that you would then be able to send to multiple plans. It can streamline your process. It can make things go a little more quickly for you when you are applying for credentialing, because you would do it once through CAQH and then be able to kind of import that information through your applications for credentialing through multiple different MCOs. So there is a benefit to it from that way, but it's not mandatory. Anybody from any of the MCOs have anything to add or correct on that response? All right, great. Then we'll move back up in the chat here to the other questions that we have. One is a clarification about whether credentialing is required for the pharmacy or for the specific pharmacist. For this training, for this session, we are discussing credentialing of individual pharmacists. Pharmacies can be credentialed by the MCOs for providing their services, but this is an opportunity for individual pharmacists to become credentialed and to begin to bill for the services that are included in the MA bulletin that was linked and discussed at the beginning of the training. So this is for individual pharmacists. Here's a question that mentions Keystone First directly, but I think that this question can apply to multiple MCOs as well. For pharmacy that has completed contracting with Keystone First and is in the process of credentialing, what would that pharmacy do in the future if they want to add a new pharmacist to the pharmacy group? My assumption would be that pharmacist would need to be credentialed individually, but Kim, I'll allow you to answer that question.
Thanks, Gwen. And yes, you're correct. That checklist, if it's a CAQH or that standard credentialing application, would simply need to be submitted for the new provider.
Thanks, Kim. We've got a couple of questions here that are kind of specific scenarios about different employment arrangements for pharmacists and how these would work. If a pharmacist is employed by a hospital and sees patients in a hospital-operated clinic, can the clinic bill for services provided by the pharmacist if the clinic or hospital has a contract with the MCO for patient care that's provided in the clinic? Anyone from any of the MCOs able to speak to that question? And it may be that the answer is that that's something that needs to be discussed with individual MCOs, but go ahead, Kim.
So yes, I would say the request to credential the provider with the hospital or the clinic be submitted, and then that would prompt discussions with the hospital system from a contract perspective as to how they would be added and reimbursed. So the first step would be that credentialing application.
And then the second part of this question here, if a medical practice or a health system owned medical practice already has a contract with an MCO, how would the pharmacist that's employed by and seeing patients in the practice be credentialed by the MCO and added as a provider under that contract? And I think that's the same process that you just spoke to.
Correct. They would be considered a new provider added to the group practice already contracted with us. So we would just need a credentialing application.
Thanks, Kim. Here's a question about malpractice insurance. Do the pharmacists need individual pharmacist malpractice, professional malpractice insurance, or can they use the pharmacy malpractice insurance? I do not know the answer to this question.
Gwen, unless I have one of my credentialing experts on the line, I don't know either, but I definitely can follow up.
Sounds like we will take this one back and provide a written response unless, Mike, I see you're here. Maybe you've got an answer for us.
Hey, Gwen, this is Mike Grisen with Health Partners Plans. So yes, as long as they're covered under that global malpractice insurance coverage, then yes, they can use that.
Wonderful. So you would need to look at the specifics of the policy and make sure that the policy includes you as an individual. And if it does, then you could use that group policy. Thanks, Mike.
Sure thing.
All right, is CAQH for physicians only? I believe it is not, but anybody from the MCOs want to confirm that? I'm pretty sure there are all kinds of different provider types that can utilize CAQH.
You're correct, Gwen. Any provider type can use CAQH. Doesn't have to be a physician.
Now, here's a question about NPIs. Does the group NPI have to be applied for in addition to the individual pharmacist NPI? Again, I'm going to have to defer to someone else. Kim?
So we would require both. Yes, the group and the pharmacist having that NPI.
Thank you. So here is, we're beginning to move into questions about claims, where a lot of those were credentialing related questions. We're going to shift gears a bit into claims related questions. What do we mean when we say submit a claim for each service? One charge per claim? A claim can contain multiple services. The claim would be for an individual patient, an individual date of service, but you might provide multiple services during that encounter. So you could submit one claim for all of the services that you provided to that individual patient during that individual encounter. Are claims still paper, or are they looking at electronic? And noted that this was answered in the presentation. So yes, paper or electronic, MCOs can accept both forms of claims. Do we need to get a signature from the patient for proof of the visit? Do we have any claims or documentation staff here who can answer that question? And if not, we can take it back for a written answer.
So standard process would be there would be a consent to treat on file. That would be something that would be reviewed in a post-payment audit, should it be necessary. So yes, that consent to treat is important.
Thanks, Kim. The next question, can someone give an example of what pharmacists will actually be doing with the patients? And so I want to pull up the bulletin that I'm looking for here. And unfortunately, I know I linked one bulletin already, but I'd like to find another one that specifies the actual services. So I'm going to include another link in the chat here, and this gives the full array of services that are going to be covered in fee for service. And like I said at the beginning, the MCOs need to cover at least what fee for service is covering. So examples would be medication therapy management. That's a great one. I think that there's other alcohol and or substance abuse screenings. There's all kinds of different services. So take a look at the list of procedure codes that you'll find in the MA bulletin that was just linked in the chat most recently. And that'll give you some examples of what these services are that we're discussing here. Get back up to the question that we were at. Okay. Can a patient use their pharmacy benefits in different areas outside of their MCO area? So yes, when an individual is enrolled in an MCO, it's not like they have to see providers within their home county, for example. People travel, people may work in a different county, and it's convenient for them to see a provider in a different county. So where those benefits are accessible is not necessarily limited. It could just be that perhaps providers would not participate in a network for an MCO that isn't a local one. All slides will be sent out, including the contact slides that give you the names and contact information for all of the people from each of the MCOs. So you will have access to those after this presentation. So a question, is the process the same for the behavioral health MCOs? You will be billing the physical health MCOs for pharmacist services. So there is not a need to go through the credentialing and contracting process with the behavioral health MCOs, as this will not be a covered benefit under the behavioral health package. So you can work directly with physical health MCOs for these services. Have all of the MA MCOs agreed to accept pharmacists in their networks, or are they required to accept? So MCOs need to have pharmacists in their network. They are not required to accept all pharmacists into their networks. However, they do need to develop adequate networks of pharmacists. And so that would be determined based on their population of members, what their needs are. And so I can't say for sure, there's not a numerical number like, oh, you need 5 pharmacists in each county or anything like that. But yes, you are going to, when you contact the MAMCOs, they are aware of their need to accept pharmacists into their networks. Let's see. If an individual pharmacist works for a dispensing pharmacy enrolled with the MCO, can the pharmacy just bill for the MTM services under the pharmacy, or would this need to be billed by the pharmacist? So I'll open that up to Kim. Go ahead.
Sure. The pharmacist would need to be credentialed, and these services would need to be billed with this pharmacist as the servicing provider. So each individual pharmacist that would be providing these services need to be credentialed, and the services need to be billed under the pharmacist.
Thanks, Kim. I have a feeling I'm going to keep you on the hot seat for the next couple of questions. For an organization with multiple pharmacists, would each pharmacist register individually, with CAQH and through credentialing on their own, or is that something they would talk to their organization about, whether they do it for you? I would say start by talking with the leadership of your organization. It's possible that you have credentialing staff that will handle these things, and you may just need to supply your information to them. But Kim, anything that you would add? I mean, obviously everyone needs to be credentialed individually, but whether the pharmacist themselves or maybe administrative support professionals within the organization would do that, I think will depend on the organization.
Correct. And I would strongly recommend that they check there, as you said, because there's most likely a process to support them becoming CAQH and credentialed with the MCOs.
Thanks. If a pharmacist is working in multiple pharmacies, does the pharmacist need to credential for each location?
So we would need all the locations listed because that's how we display them in the directory for our members to be able to access. So the credentialing app is one application. We would just need the locations that that provider will be providing services.
One application, multiple service sites listed.
Correct.
Here's a question kind of about claims. Do specific payments for services performed by a pharmacist get paid to the pharmacist or to the company the pharmacist is employed by? I think this will depend on the way that the contract is set up, but my understanding is that almost universally these are going to flow to the employing organization, like at the TIN level, most likely.
That's correct. That's where the contract will be as well. There are exceptions to that if you have an independent pharmacist, a solo pharmacist, that happens to be both the organization and the pharmacist, that would be a little different, but you're correct. The payments would be issued to the employed and contracted entity.
Thanks. So here's a question for the department. Will CHIP follow the same process for pharmacist credentialing? By any chance, Terry, Cathers, Kristen, Corinne, are any of you available to answer that question?
This is Terry, and I'm not sure of the answer to that.
So we will take that back and include that in written follow-up from today's conversation. Let's see, next one. When you apply, if the pharmacy is enrolled through the plan, you just need to enroll the individual pharmacists. Yes, that's right. This one, we just addressed our payments made to the organization that the pharmacist works for or directly to the pharmacist. Kim just answered that question. And we discussed, can a patient use their pharmacy benefits in different areas outside of their MCO coverage area? Let's see. Is the consent to treat by the practice inclusive of the services provided by the pharmacist? I think that's a specific question that you'll likely need to address with practice management, unless anyone on this call has a response to that. Sounds like that's something to take back to your practice management or administration. Medicaid does not currently allow telemedicine visits by a pharmacist, the place of service code 02. If an MCO wishes to allow payment for telemedicine services, for example, anticoagulation management, is the MCO permitted to contract for this type of care provided by a pharmacist? Yes, the MCOs are able to contract for places of service and modalities of service beyond what fee-for-service covers. If our pharmacy is already credentialed with the MCOs, do we need to apply for this new fee-for-service for our pharmacists? That really depends on whether you want to be billing for the services that are included in the scope of that medical assistance bulletin. If you're not looking to provide and be paid for those services, then there would not be a need to. But if this is a service that your pharmacists can and would like to offer, then you should begin the process of enrolling and credentialing and contracting. Where can we go to view the follow-up to this meeting? I will distribute after the meeting to all attendees that I have a record of through the Teams meeting, a link where the recording of this session, as well as the slides, as well as any written follow-up will be posted. It's on the department's website. Can a pharmacist that does not work for a company still be able to be credentialed and get paid for providing these services as an individual? I believe the answer to that is yes, but Kim, Mike, anyone else on the line have a response to that?
Yes, they would just need to follow the contract application process and the credentialing process. Mike, anything you wanted to add to that?
Completely in agreement, Kim. Thanks.
All right, are pharmacists required to enroll in order to bill for vaccine administration? Anyone able to take that one, whether that's department staff or MCO staff?
So I believe this is one of the billable services added, and I'm sorry, I don't know the list off the top of my head yet, a little too new. But if the pharmacist is asking to be reimbursed for these services, then they would have to again go through the contract application and cred process in order to receive that reimbursement.
Thanks, Kim. Terry or team, anything to add to that response?
I'm sorry, what was the question again?
Are pharmacists required to enroll in order to bill for vaccine administration?
No. I don't, yeah, I don't think so. Because the
Because that's a service that
pharmacy,
could be billed through the pharmacy itself.
you know, let's take that back. I want to make certain
Okay.
that nothing has changed since we are doing the pharmacist enrollment. Yeah, let's take that back.
Thanks, Terry. We will take that one back just to confirm. If a patient is covered under a capitated contract with their provider, how does that impact provision of and payment for pharmacist provided care? That's going to be a pretty specific conversation to have with the MCO at the time of contracting. So I'm not sure that we'll be able to provide kind of a global response to that across the board here. But if you are aware, for example, that your pharmacy or the clinic or the hospital, whatever organization the pharmacist is employed by and practicing in, if there is a capitated contract in place with the MCO, that is absolutely something to bring up during the contracting phase to discuss whether these services would be carved out or whether they would be included in that arrangement. There's kind of two questions related to documentation here. Besides consent to treat, are there any other documents needed in case a service is audited? And relatedly, are there specific documentation requirements for provided services that MCOs will require for pharmacists? Does anyone have any feedback to offer about specifically what needs to be documented from an encounter or any references that we can direct folks to for information about that? And if not, then that is something that we can also take as a follow-up to provide some additional detail or resources about where to look for information about required documentation. Is there
Hey,
a way to
Gwen.
indicate? Yeah, go ahead.
Hi, this is Perry.
Hey, Perry.
I can tell you what I'll look for. It's a very simple SOAP note: subjective, objective, assessment, and a plan.
So
Now,
a SOAP note in the medical record.
there are variations on that they could certainly use, and you can develop your own note for a pharmacy service. But if I'm doing an audit, I expect to see those basic elements in a note. I want to see a short history. I want to make sure that the medications have been addressed. I want to make sure that there's somewhere in the record a short family history and an interim progress note, so that I know that the pharmacist has actually addressed everything and is looking to address the specific issue in question. And also want to see what services were provided and make sure that that corresponds to what's on the claim form.
Thanks, Perry. And that was Dr. Perry Meadows from Geisinger Health Plan. I think we will follow up with some more formal guidance and written explanations about what should be included. We may need to sort of poll all of the MCOs to make sure that no one has a different approach, but we will put something together in writing after this meeting to respond to those questions. Is there a way to indicate interest in telehealth delivery on the contract application, or how would that discussion take place? Any of the MCO contracting folks want to talk about how a pharmacist could indicate, whether it's the telemedicine modality or an additional service maybe beyond what's in fee for service? How can those conversations get started?
Hey, Gwen, I can just make a quick comment here. I mean, we do have very defined telehealth policies that are available out on our website that anybody can access and review what our approach is to telehealth payment. But we would certainly welcome any conversation during the contracting process if the services looking to be rendered in a telehealth environment are not covered by our policy. We would welcome that conversation at the contract process.
Thank you, Mike. Here's a question about billing as well. How do we know if a member has reached the billing limits for procedure codes? So for example, if there were quantity limits on a code, how might the pharmacist know that those limits have already been reached before going on to bill for those services? Is there a way to know that?
I would say for us, our provider portal does provide eligibility and benefit information and does describe that level of detail. So if there are limits, it would describe that.
So it would describe the limits, but not necessarily say whether for an individual patient those limits have already been reached.
Correct.
Okay. Kim, I see you nodding. It seems like the
Yeah,
same.
it's the same. Correct.
That's
Any
the same
other
for us as
MCOs?
well.
Same
That's the
for
same for us
Geisinger
as
as well.
Yep.
Thank you. If your services as a pharmacist are currently bundled, can you still bill for individual services provided, or is it an either-or situation? Definitely something to bring up with the individual MCO as you're discussing contracting, whether there are any services that are carved out from that bundle or whether these would all be included in your bundle. So that's a question for specific MCOs during the contracting conversations. We've got a couple more questions that have come in about documentation. I suspect that we'll likely need to include these in the ones that we provide written follow-up for. For example, can the notes from our EMR, our electronic medical record, be used for the notes if they're in a healthcare setting? I would assume yes, but we can provide a written indication of that as well. And what documentation of care? Go ahead, Perry.
The answer to that is absolutely, Glenn. In fact, I'd be happy to, and I'm sure the other MCOs would as well, to help the pharmacists develop templates for their notes. Templates and EMRs make life a lot easier.
Thanks, Dr. Meadows. So if anyone is looking for anybody who would be able to assist with developing some EMR templates, Dr. Meadows from Geisinger Health Plan has volunteered for that. What documentation of care will be required if the patient record if billing for vaccine administration? That's another one we can follow up with specifically. Is a specific referral order from a physician required for a pharmacist to provide services? Terry or your team, are any of you able to speak to that, whether a referral from a physician is required?
I'd like to take that back. When I saw that in the chat, I'd like to take that back and respond in writing.
Thanks, Terry. And I realize I have not introduced Terry Cathers. Dr. Terry Cathers is our pharmacy director here at the Department of Human Services. Would we be able to provide the link for the telehealth policy? I will, in a moment, go find the department's telehealth policy, but it is also relevant to know that each MCO has their their own telehealth policies that kind of supplement the department policy. But I will find that and drop that in this chat as well. Is there a way for pharmacists to verify patient eligibility for services, or are all patients eligible for any appropriate service included in the pharmacist contract? That's a great question. So the first method would be to determine whether your patient is enrolled in medical assistance, and you can do that through our electronic verification system. I'll provide some information in the chat about how to do that as well. But when you are confirming their eligibility and their enrollment, that will tell you what benefit package they're in. So anybody who is in the Physical Health Choices program enrolled in one of our MCOs, they're going to be eligible for any of your services that are covered in your contract that are medically necessary for that patient. Here's a question about some specific codes, the MTM codes. Have any of the MCOs established criteria for care provided to bill for these codes? Any MCOs that have worked on what your requirements are going to be for these specific codes? And if not, or if we don't have the right folks on the call today, I think that's a conversation to be held during contracting as well. All right, sounds like that's something to follow up with individual MCOs about. Any pharmacy-specific guidance on the E&M code level determination would be appreciated in the follow-up as well. Noted, thank you. All right, I did just put the telehealth policy bulletin link in the chat. I need to find the electronic verification system link to drop in here. And then that will take us through all of the questions that I am able to see in the chat at this time. So any more questions from individuals who haven't had the opportunity to speak up, particularly anyone who doesn't have access to the chat that would like to ask your question out loud? I see, let's see, a hand raised. Megan Dixon, go ahead.
Sorry, can you hear me? I was just waiting for my stuff to unmute.
Yes, we can.
Okay. I just want to make sure I like understand completely. Applying for like chain pharmacies. I understand the need for credentialing individual pharmacists. Just the applications in general, would it be, I guess, us as a corporate entity applying and then listing all of the pharmacists and which locations they practice at? Or would it be an individual application for each location?
Mike, you want to go ahead?
Sure. So from a contract perspective, it would be at the organizational level. We would need a single contract for the entity, but then each individual pharmacist would need their own CAQH application and to be credentialed individually. We do have a one-page document we call a provider data collection form that kicks off our credentialing process, similar to the way Kim described their process, that we would need filled out and submitted for each individual pharmacist to initiate credentialing.
Okay, perfect. That makes, at least it's like one contracting application and then individual
Correct.
for each pharmacist that works with the entity.
Correct.
Okay.
And then through the credentialing process, you would identify for us, and CAQH helps to do this for you.
Okay.
We would load all of the locations that you've indicated on that application where that provider or where that pharmacist actually renders services.
Okay. All right. Awesome. Thank you so much for the clarification. I
You're
appreciate
welcome.
it.
Sure.
Thanks, Megan, and thanks, Mike. I see Tanya Fabian.
Thank you, Gwendolyn. I wanted to follow up. I'm the director of pharmacy at Western Psych, and I asked the question about the behavioral health MCOs because, my pharmacists are employed under Western. And, for any of the services that we provide through Western, Monyac, our community mental health centers, we bill all of our other providers. We do not bill through the physical health MCOs, and we do not have contracts. So I'm just wondering, I just wanted to circle back to my initial question just to make sure I'm not missing something, that we would then now have to have contracts specifically just for the pharmacist providers.
Yeah, that is my understanding here, that because these services fall under the physical health package of benefits, that they need to be billed to the physical health MCOs. Terry Cathers, any chance you have a different interpretation or anything additional to add to that?
I don't have another take on it. I was interested in your response when the question was first posed. So maybe that's something that we need to just verify internally and provide it in writing.
Thanks, Tanya, and I appreciate you following up and letting us know that you're the one who asked the question, so that we can also follow up directly with you, since I think this may be a kind of unique scenario for pharmacists that are employed by behavioral health provider types.
Thank you so much. We tend to be different, and my motto for this whole thing is no pharmacist left behind. So thank you
Hey,
for
I love it.
including us. Thanks.
Thank you. All right, let's take another look at the chat because I think we've had a couple of things come up. For a PA-RPH license, you must have graduated from an accredited ACPE School of Pharmacy. What additional education documentation are you looking for? So I would assume this question is during the credentialing process. MCOs, are you looking for anything beyond graduation from that accredited School of Pharmacy and the accompanying license, or is that sufficient?
That would be sufficient for us. That is the requirement for a pharmacist. And this is Kim, sorry.
I would agree with that.
Thank you. Can we please list the links in the follow-up? Absolutely. We will, anything that has been linked in this chat, we will be sure to reproduce the link in the written follow-up as well, that will get distributed to attendees as well as posted on our website. All right, here's another question. Can you further explain, in hospital-based clinics, Medicaid only reimburses for either the facility fee or the professional fee? Are pharmacists also able to bill the facility fee or only the professional fee? Does anyone have an answer to that today? And if not, then I think that is a specific question to ask the MCOs when you are going through that contract phase, to clarify exactly which fees you will be able to bill for in that hospital clinic setting. Tanya, I do see that your hand is raised. Am I able to lower your hand? Is that your question's been answered, or do you have an additional
yes.
one?
No, I'm sorry. Thank you so much.
No problem. Just wanted to check. All right. Any further questions? I know we've got several things that we've agreed that we're going to take back and provide written responses to. I see one more that came in here for chain pharmacy. If a pharmacist is credentialed at one location but then works at another, can they bill, or do they need to add to the new location before being able to bill? So maybe during credentialing, you only listed one of those locations, but then surprise, they get asked to go work a day over at a different location.
We would definitely need those locations loaded into our system for adjudication purposes.
We would as well. They would just have to provide us the additional addresses.
And here's a specific question for you, Mike, for Health Partners, provider enrollment. What is the choice for provider type? Is that specialty as well?
Correct. It would be pharmacist. Would be
Pharmacist.
sufficient for that.
Okay. We've got a link that was dropped in the chat from United Healthcare. Their link to request enrollment is available in case you are looking to serve United Healthcare members. Any final questions before we wrap things up? Well, I want to thank everybody for your time and attention today. I know this is a complex topic, and unfortunately, there are so many unique scenarios that we can't necessarily address every single one in a format such as this. But you have our commitment to follow up in writing for any questions that we weren't able to answer today. And of course, as you are having those conversations with individual MCOs during your contracting process, that is a great time to bring up any of those questions that you have, particularly pertaining to billing. That's going to be a really an important time to ask those questions of MCOs directly. So thank you all so much for your attendance today. We are really thrilled to have pharmacists be joining the Medicaid program, and the department is really committed to making sure that this is a successful rollout. You're a really important point of access for our members, and we just really appreciate your interest in serving our membership. So thank you for that, and we'll be in touch with all of the follow-up that we've committed to. So have a wonderful day, and thank you so much for your time and attention. Take care.
Gwen.